So hi, I'm Lisa De Biasi. I qualified as physiotherapist in 2007 in Italy. I have a master's in manual therapy, and here at BodyRight I treat musculoskeletal pain and injuries. Well, it's every pain that is could be caused by muscles, ligaments, soft tissue structures, and yeah, it's not neurological pain, okay, or it's related to your musculoskeletal system.
My name is Warren Barry. I'm a chartered physiotherapist at the two clinics in Berkeley Street in Dublin and Cross Lanes in Drogheda. Primarily, physiotherapy is about addressing patient problems, so we'd see a number of different patient conditions coming in the doors in the clinics, right through from sports injuries to neck pain and back pain. So those three areas would be really the ones that we'd see the most of coming in the doors in the clinic. So I actually work as a sports physiotherapist, and I've done so across a number of rugby teams in the Dublin area. So this has really allowed me to gain experience pitch side from really sort of acute presentation from a player going down. I generally would see the process through from the initial injury right through to rehabbing the patient successfully to getting them back out, returning to play, back to where they want to be for whatever sport it is they do. I suppose one of the main things that the Dublin Clinic has that sets it apart is the cryospa facility. So the cryospa is a water-based immersion therapy. So what this involves is a person would actually get into the cryospa, and it's based on water being chilled at about 5 degrees, and there's Epsom salts and magnesium in it. So what that's really effective for in acute sports injuries is that you'll have the pain and swelling, inflammatory process that happens after a sports injury. The cryospa is really effective in promoting tissue healing in the initial stages of injury. So in treating sports injuries, I take an approach that incorporates a number of different therapy approaches, right through from manual therapies to electrotherapies. I believe the use of evidence-based exercise prescription is the most important part of rehabbing a person successfully when they have sports injuries. So in this regard, the rehab process is what gets the patient back to where they want to be, back doing what they need to do.
Robert is my name, and I'm a chartered physiotherapist here at BodyRight Physiotherapy. I qualified from the Royal College of Surgeons in 2014, and I'm now based in our Drogheda clinic. My special interests would lie in sports injury management and rehab, so taking patients from all ages and all levels of sports and taking them back to their highest level of performance. I also do a lot of soft tissue techniques such as dry needling, joint mobilization, and joint manipulation. I think we've got a wide variety of physiotherapists here from different backgrounds, and I think we can cater for any problem that anyone would have, either musculoskeletal wise or post-operatively. I also have a keen interest in foot biomechanics and orthotic prescription. In our Drogheda clinic, I enjoy teaching our modified Pilates classes, so I get to work with a wide variety of patient groups, from our low back rehabilitation class to our sports Pilates class as well.
So my name is Ann Gavin, and I qualified in 2005. I have a science degree from NUI Galway, and I studied physiotherapy in Queen Margaret University in Edinburgh. I initially worked in BodyRight part-time in 2008, and I returned full-time here in the Dublin clinic. So I treat a variety of conditions here, including back and neck pain, orthopedic and sports injuries, and I also treat the women's and men's health that come here as well. The treatment techniques that I use include massage, joint mobilisation, acupuncture and dry needling for musculoskeletal conditions. I also teach Pilates here, and I use some of these exercises in patient rehabilitation.